The application of knowledge is power. Today, I'm going to share with you a review article by a group of biologists and medical scientists from the School of Medicine, Georgetown University of Washington, year 2018, entitled A Clinical Trial Review, Mesenchymal Stem Cell Transplant Therapy in Type 1 and Type 2 Diabetes mellitus. Type 1 diabetes mellitus manifests due to autoimmune destruction of the pancreatic beta cell, resulting the diminished secretion of insulin, where type 2 diabetes mellitus originates from a state of insulin resistance, resulting hyperglycemia and the reduction in beta cell mass. Recently, mesenchymal stem cell, MSC, have been proposed as a possible curative treatment method. In this review, we will explain the molecular mechanism underlying MSC and their potential ability to treat type 1 and type 2 diabetes. We describe the capability of MSC to differentiate into insulin-producing cell and regenerate pancreatic beta cell, as well as assess their role in modulating in the immune system. Introduction. Diabetes mellitus is a group of metabolic disease characterized by hyperglycemia, the sequelae of defect in insulin secretion, insulin inaction, or both. Diabetes mellitus has emerged as one of the major public health concerns worldwide. Type 1 diabetes mellitus. The cause of hyperglycemia is a deficiency in the insulin secretion as a consequence of organ-specific immune destruction of the insulin-producing beta cell in the pancreatic islet of Langerhans. Type 2 diabetes mellitus. The cause of hyperglycemia is a combination of cellular level resistance to insulin action and an inadequate compensatory insulin secretory response. The chronic hyperglycemia that occurs as a consequence of diabetic mellitus is a major risk factor for long-term damage of different organs, including eyes, nerve, kidney, heart, and blood vessels. Treatment options for diabetes mellitus includes weight reduction, exercise, and oral anti-diabetic agents. For patients with extensive beta cell destruction and therefore no insulin secretion, exogenous insulin is required for adequate glycemia control and survival. These therapeutic regimens are less effective in the reversing of insulin resistance and do not prevent the progressive beta islet cell degeneration, and therefore ineffective in the altering the progression towards diabetes mellitus. Recently, mesenchymal stem cells derived from different adult tissues have attracted great attention as a more promising treatment for diabetes mellitus. MSC possessed the capacity to differentiate into islet insulin-producing cell, IPC, to promote the regeneration of the pancreatic islet beta cell and to protect the endogenous pancreatic beta cell from the apoptosis through immunomodulatory mechanism. Pathophysiology of type 1 and type 2 diabetes. Diabetes mellitus was recognized more than 100 years ago, and type 2 diabetes was recognized in 1936. In a healthy state, a feedback loop exists between pancreatic beta cell, liver, skeletal muscle, and adipose tissues. Beta cells secrete insulin. Insulin then augments the glucose, amino acid, and fatty acids uptake in the adipose tissue and skeletal muscle, while suppressing the glucose neurogenesis in the liver. The insulin-sensitive tissues then feedback to beta cell to prevent from excessive secretion of insulin. Type 2 diabetes mellitus, often referred to as a state of resistance to insulin, demonstrating a diminished capacity of the glucose uptake, resulting to hyperglycemia. The adipose tissue and skeletal muscle are unable to exert negative feedback to the pancreatic beta cell, resulting sustained secretion of insulin and potentially hyperinsulinemia. When the pathological state continues, the beta cell mass decreases. Type 1 diabetes mellitus is an autoimmune disease resulting from a multitude of genetic and environmental factors that leads to the lack of self-tolerance and ultimately the destruction of pancreatic beta cells. Hence, it is a dysfunction of the immune system. I'll share more next time.